Okay, moving on. That was one of the sort of topics that I wanted to cover um, that we hadn't um, uh, gotten to as much. I wanted to talk next. One of the other topics I want to discuss here that was covered, that's covered in the text and was listed as a topic in the lectures was reasons why patients don't take medications. And it's interesting in fact, it's interesting. I just had a patient today, a new patient for psychotherapy. It was interesting. Um, I, um, uh, One of the areas of specialization I have for cognitive behavior therapy is working with individuals who have psychosis, cognitive behavior therapy for psychosis, hallucinations, delusions. And but one rule I have, and I will tell people this when I work with them, is I will not work with someone who has psychosis unless they've been evaluated by a psychiatrist, or unless they also have had a recent evaluation by a psychiatrist. And I have a pretty solid policy for that. It's more of an ethical um, guideline. The main treatment for hallucinations or delusions is psychiatric medications. It's not the only treatment, but certainly it's the front line. And I don't think it's ethical to be seeing someone who's not on that sort of medication, because hallucinations and delusions can get very dangerous. And in fact, this woman, when I met with her, she's married, and she talked about having a recent episode where she was having auditory hallucinations of voices telling her that her husband, and at the time, she was sitting with her husband, that her husband was thinking of harming her, that her husband was going to harm her. And she stated how the voices were telling her to either harm herself to stop it or harm him. And of course, that's a very dangerous situation. I'm not a big fan of psychiatric medications. I'm also not a big supporter of psychiatric hospitals, but sometimes they're necessary in order to keep the person safe. And being able to address situations like that is the sort of reason that if someone's psychotic, I will insist that they have at least a recent evaluation by a psychiatrist, because the hallucinations and delusions can get so dangerous so quickly and without notice. They have to have some degree of um, uh, some medical intervention, or at least been assessed for a medical intervention to uh, to keep those under some control. And why I bring this up is interesting. When I talked to her about why she didn't want to be on psychiatric medications, it was very common. She brought up some statements that were common from other people. The primary one she had, she didn't like to feel nothing. It was interesting that now I will also say, when I talked to her about it, she felt very confident that her husband has learned how to really talk her down from these situations. So even though she was hearing these voices, she did not feel that either she or her husband were in any real danger, because her husband knows kind of how to keep her in check as far as not letting this go too far. But it was interesting. The main thing that she brought up, which is probably the biggest reason that I hear for why people don't want to take psychiatric medications, is because they make them feel very little. In fact, what I may have brought up in the course, the saying I've often connected it with, is people saying that their antidepressant medication doesn't make them feel good, doesn't make them feel bad. It makes them feel nothing. Um, and there's just there is a real sense of a lot being taken away from you when you are on psychiatric medication. It's interesting where I've seen this the most and probably heard this the most is not even with schizophrenia, where there can often be a degree to which uh, people might recognize that even though they don't like how the medication makes them feel, believing that they're hearing voices telling them to hurt other people or hurt themselves is enough of a problem to sort of motivate them to stay on medication. But what's particularly interesting is where I've uh, heard it the most from is people on bipolar medication. Because it's interesting to think that this episode of mania, that this manic episode, is not always, if people are being honest, it's not always something that with bipolar people want to get rid of. Most of the time when people have been having manic episodes, when they have talked openly and honestly about why they're looking to change it, it's because of the impact that it has on other people. Um, Overspending can be a problem with mania. Sexual promiscuity, so having sex with people other than their partner. Um, Getting a lot of things done, keeping very active can be very distressing to the people they are in relationships with. If people are being honest, they don't always necessarily want to get rid of that feeling. They may want to get rid of, and very often want to get rid of, the negative impact that it has on their relationships. But the feeling of just sort of being invincible and getting things done and being able to do things that they find enjoyable at a higher level, that isn't always something that people want to get rid of. So a lot of people I know with bipolar disorder have a real love-hate relationship with their medication. Uh, they like the positive impact that it has when they're under more control as far as the people they're in relationships with not being so upset with them. But if they're being honest, they aren't always so glad about getting rid of those episodes of mania, which can be um, exciting, if not, maybe the word wouldn't be happy or positive, but certainly the word exciting often comes into those things. So there's really it, there's this idea that psychiatric medications make people feel numb. And if there was an emotional, if you want to consider it an emotional um, aspect to it, um, the word they probably use most of the time when they're on psychiatric medication is bored. That that uh, that what psychiatric medications do is make their lives more boring. Boring isn't always a bad thing, but there's a real sense of loss there. Now, other reasons people don't take psychiatric medications, and this probably comes up more with schizophrenia and the antipsychotic medications, are the side effects. It can be intense for psychiatric medication. Joe, we have talked before about some of the side effects of certain medications like ADHD medications, antidepressants, anti-anxieties, which can be um, reduce energy, reduce motivation, uh, inability to perform sexually, um, uh, increased appetite, which means putting on weight, decreased appetite, which can be, both types of side effects can be related to psychiatric medications. When it comes to antipsychotic medications, those side effects are considerably more severe. Tardive dyskinesia, which we have talked about, tardive dyskinesia, which is essentially a form of Parkinson associated with antipsychotic medication mostly. There is a disease that can be associated with the use of antipsychotic medications. And I apologize, don't like on the name, but the most important thing of it is that basically antipsychotic medications can lead to a disease where the body's ability to regulate internal temperature breaks down. which can be fatal. So there are some very severe side effects, and antipsychotic medications, as I said, feeling nothing is probably the most common um, example. The other one that's pretty common is feeling quote unquote weird, which is just sort of like a fogginess, inability to concentrate, inability to um, figure out what's going on. It's almost like when people talk about being antipsychotic, you could almost picture chemically what's happening. It's suppressing the voices um, that are going on. So the person isn't having internal communications that tell them that somebody is talking to them in a very real way. But it's also basically the medications often not only quiet the problematic voices, they quiet all the voices. So, the internal dialogue that we all have that kind of gets blown in a different direction with psychosis to become almost an external voice talking to them, that gets quieted as well. So the person has difficulty making sense of almost anything because their brain just isn't functioning very well. So that's another. So side effects and how medications make people feel are two very strong reasons why people often do not take their medications, psychiatric medications. I wanted to pull up another slide for the next thing that I wanted to talk about. It's just a single slide here, but this has to do with some of the uh, some of the issues. And I don't. Oh, here I couldn't find the thing to make it full screen. Some of the issues related to suicidality as a side effect, particularly as it goes to antidepressants. And I wanted to just make a few notes of that. Primarily SSRIs, and the can increase the possibility of suicide. And now they definitely increase it is definite that suicidal thoughts are increased. It can be increased as a side effect. That is a definite side effect. The degree to which suicide actually resulting from those thoughts, how much that increases on these medications, that's up for debate. But since there is this increase in individuals reporting suicidal thoughts that are very real, there is sort of an assumption that it also leads to increased suicides, although the numbers are sort of unclear about that. But definitely suicidal thoughts increase. It's especially the case. Now, here's what I really want to. There were a couple just facts about that. We've talked about that side effect, but there were just a couple facts I wanted to bring up. One are the medications, primarily SSRIs. And here are an example of four of the ones that tend to be most associated with increased suicide risk: Paxil, Zoloft, Prozac, and Luvox. And then it tends to be more of a likely side effect in children and teenagers. By children, they mean teenagers as well. And it tends to occur when dosages are either increased or decreased. This is an important thing, I think, is that not only it tends to happen in younger people, but you have to be the most on watch for them when the dosages are being changed. There's an FDA list, I didn't include it here, of 10 popular antidepressants where this is on the warning label. And what's interesting is Great Britain went a step further. They didn't just list it as a on the warning label. Great Britain declared that there were some of these antidepressants. I think all four of these are on that list, but I'm not sure. Are too risky for children under 18. So they went a step further. They said you just should not be using these SSRIs when your patient is under 18 years of age. Okay. One other thing I wanted to talk about is just one other topic that was covered in the readings and in some of the recordings, some of the videos that you reviewed, has to do with therapy and medication management. I just wanted to, there was a lot in there, but I just wanted to review with you what is sort of considered the general rule about the combination of therapy and medication. And that's this, that the way it's always been explained, the way it is typically presented is, the general rule is medications tend to work quicker, but can wear off in a relatively short amount of time. The effectiveness can wear off. People often have to have changes in their dosages after they've been on a medication for a while. So medication is seen as the quicker solution that doesn't last as long. Therapy is considered to be something that takes a longer period of time, but because it involves changes in how the person lives their life, is considered to be longer lasting. So the difference between, the combination of the two. So the general recommendation for almost any condition is that the person should be both in therapy and take medication. It also, when you look at it that way, it can help you see one of the reasons why people often opt for medication without therapy, and even if it's not the recommended approach. And that's because the therapy can take a while to work. It's a lot of work, it's expensive sometimes. And even though they may recognize that getting a different view on how to deal things would benefit them a lot, they just don't take that route because it's too much time, too much money, whatever. So that's just something I wanted you to keep in mind on that. So okay, and then was one other thing that I wanted to bring up. Okay, and then the last thing that was in one of the video lectures that was that was included in there that I wanted to talk about, it had to do with curcumin, which is the main. Here's what I wanted to talk about. Why I wanted to. You can read it, so I'm not going to go through a whole lot about it. But where I thought was interesting is curcumin. One of the videos in the depression week, the week that we covered depression, was a video on curcumin in depression. And curcumin is the main active ingredient in turmeric. It is considered a natural supplement. It has been found to be effective in treating anxiety and depression, primarily because of its impact on inflammation. So I wanted to just talk briefly, again, only briefly because it's in the readings and some of the materials, but about what this situation is with inflammation and how it impacts depression and anxiety, because that relates directly to the subject of curcumin and its impact on depression, because curcumin is the active ingredient of turmeric, and turmeric has its main impact on lessening inflammation. So just going through some of the basics of inflammation. Appropriate inflammation in the body attacks foreign bacteria and virus and damaged cells as a way of protection. It basically does cleanup. Keeps all the bad stuff out. But when there's inappropriate chronic inflammation, the immune system starts to attack healthy cells, the cells that are supposed to be there. Okay. What happens with, let me make sure I didn't skip over it. That's why, right down here. So in inflammation, bad inflammation, what it can do is a couple of things. It decreases, it increases glutamate and decreases this, the combination of these to um, uh, basically it not only increase glutamate, but by decreasing this neuroreceptor, it increases this some more. So it's almost like you go past the point where glutamate is healthy and starts to increase to the point that it causes problems. It also it allows neurotoxic substances to go into the brain and decreases the brain's ability to protect itself. So it increases a lot more bad stuff, quote unquote, in the body while reducing the brain's ability to protect itself from bad stuff. Inflammation causes dopamine levels to rise, which can lead to insomnia, feelings of anxiety and agitation. Now, one of the things I find most important about this is this whole idea, and we'll talk about that a little bit more when we get into antipsychotics. Glutamate and dopamine, at one point, remember, we were talking about how some of the medications help to increase it. You can increase those things so much that they become a problem. Something to keep in mind about all this neurochemical stuff is there can be too little, too much, or just enough. And it's not this sort of, ongoing upward graft where the more of you have of it, all the neurochemicals are definitely function on what is called a bell curve, meaning that there's a point where you reach the optimal level, but then so it's curvilinear is the term. You reach the point where there's an upper level, but then you can, once you get past that level, it can start to become a problem on the other end. So you can have too little or too much. What does an anti-inflammatory lifestyle look like? Better diet, more exercise, detoxification, and stress reduction. Sugar is considered a big problem there. And then, low sugar, low carbohydrates, healthier diet, and, watch out for food sensitivities. Okay. I just wanted to go briefly through that. I think we've covered enough of like I said, I just wanted to cover some of the stuff that we didn't cover in some of the other classes, and we're covered either in the videos or the book. And we'll stop here, and I'll see you on Thursday.